Hi everyone, my name is Dr. Brendan Rowe, and this is Real Talk Mental Health located in Vancouver, Washington, where we talk about all things mental health, like how to identify if you're depressed or actually have ADHD, how to navigate the mental health care system, and in this episode, how to tell if you're experiencing severe depression. If this is something you're interested in learning more about, make sure you hit that subscribe button and tap the notification bell so you're notified every time we come out with a new video. So let's dive in. How to tell if you're experiencing severe depression. Signs of severe depression can include feelings of hopelessness, increased irritability, loss of pleasure, trouble concentrating or sleeping, or thoughts of death or suicide. Technically, severe depression is not a formal mental health diagnosis. Rather, it refers to depression that is more debilitating in nature. The degree to which your symptoms interfere with your day-to-day, such as causing you to miss school or work, helps medical providers determine the level of severity of your depression. I tend to think of depression as being on the spectrum. It should be noted that there are several types of depression, and while they may share some common symptoms, each person's experience can be very different. Symptoms of depression can occur along a spectrum both in duration and severity. Mild depression can occur during periods of stress but resolve with time and may not require any specific treatment at all. Moderate to severe depression causes chronic symptoms that usually require at least one form of treatment, if not multiple treatments like medication and therapy. If someone has severe depression, they may self-harm, have suicidal thoughts, or be at risk of attempting suicide. If you are severely depressed, there is help available to manage your symptoms and ensure your safety and well-being. If you are diagnosed with a form of depression, the severity of the condition will be assessed by your health professional based on their training and experience. When determining if depression is severe, there are some key signs and symptoms clinicians consider. Feeling a profound sense of sadness is common with depression and may be persistent and intense. Anhedonia is depression that rises to the level of losing interest in most everything in your life. Research reveals that anhedonia is often worse in the morning hours and is typically accompanied by slow movement, trouble concentrating, and a loss of appetite. Depression can appear physically via symptoms felt in the body. Examples of physical effects of depression include sleep disturbance, appetite changes, poor concentration or memory, and a loss of interest in formerly pursued activities or interests like hobbies, socializing, or even sex. Some people with depression may also feel chronic pain, experience gastrointestinal side effects, or have a higher level of fatigue. When depression is severe, the basic tasks of daily living feel overwhelming and burdensome. Many people will fall behind on important responsibilities like paying bills, not necessarily because money is scarce, but because opening mail and following through with important tasks is mentally exhausting. Severely depressed people may also struggle to perform basic hygiene like showering, bathing, doing laundry, or cleaning the house. Sometimes people have changes in appetite or weight. Many of clients report having a diminished appetite, while others report overeating to self-soothe. Still others may self-medicate with substances like alcohol or excessive cannabis use to dull the sadness. Severe depression is neurodegenerative, meaning it can cause changes in the brain function. Many people may experience a noticeable slowing down of mental and physical activity. Clinically, this is often referred to as psychomotor retardation and can include impairment in fine motor behavior, such as having trouble trying to pick up a coin from the floor, speaking, or facial expressions. Fortunately, there are several treatment options for severe depression. If you have been experiencing the symptoms I've been discussing for more than 2 weeks, it's important to seek out a mental health evaluation from a therapist or a medical provider. Your provider can decide the best treatment for you based on your symptoms. Other factors considered when suggesting a treatment plan include your level of function and if you're considering harm to yourself or others. Options for treatment include psychotherapy, also referred to as talk therapy. Different types of psychotherapy for depression include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. Medication is frequently prescribed to treat severe depression. The most common type of medication used is the selective serotonin reuptake inhibitor, or SSRI. This includes antidepressants like Prozac, Zoloft, Lexapro. If an SSRI doesn't work for you, your provider might try a different type of antidepressant, like a serotonin norepinephrine reuptake inhibitor, such as Cymbalta, Venlafaxine, Pristiq, or Fatsima. While there are many effective treatments for depression, first-line approaches such as an antidepressant or psychotherapy do not work for everyone. In fact, approximately 2/3 of people with depression don't find adequate relief from their first antidepressant. If you've already tried 2 or more antidepressants along with talk therapy and continue to feel depressed, don't give up hope. One fantastic option is transcranial magnetic stimulation. It's also known as TMS. TMS is an FDA-approved treatment for depressive symptoms that have been resistant to 2 or more antidepressant trials. TMS is an outpatient treatment based on decades of research and is very safe, non-invasive for treating depression. They use an MRI-strength magnetic coil to target specific areas of the brain that we know are involved in depression. TMS does not require anesthesia, and it's exceptionally well tolerated. To be clear, there's no shock and it should not be painful. Patients may feel a tapping sensation on the scalp while the magnet is pulsing. TMS is helpful in normalizing brain chemistry. The best part about TMS is that there are no systemic side effects because the magnet is only targeting the part of the brain where depression is rooted, and the magnetic field does not reach the level of the heart, liver, kidneys, stomach, and so on. The TMS protocol for severe depression consists of about 6 weeks of treatment. Each treatment is about 19 minutes, 5 days per week. Treatment is quick, shouldn't interfere with your ability to drive or work. Most providers find that TMS has a response rate between 70 and 80%, meaning most individuals find significant relief through their treatment. About 50% of people experience total remission of symptoms. In some cases, inpatient treatment or intensive outpatient programs may be recommended for very severe depression. Being hospitalized for depression doesn't make you weak. It simply means that your treatment may be more effective in a more controlled environment. Getting inpatient treatment allows medical providers to keep you safe as they closely monitor how well you're responding to treatment protocols. It allows them to make any necessary changes should your depression not initially respond or become worse. While it may take some time to find the most effective way to manage symptoms of severe depression, knowing that the situation is not hopeless is key. If you're trying to find the right treatment, keep in mind that there are several ways you can support yourself through the process, such as focusing on eating a nutritious diet, adding some physical activity, and trying your best to get some good sleep. Remember, major depressive disorder is a medical condition. You would never tell a loved one with heart disease or chronic diabetes to just snap out of it. Moving beyond depression is not about willpower or mindset, so please be kind to yourself and allow time to heal. Well, that's it for me, everyone, and this is what I would explain to my patients who were asking if they were experiencing severe depression. Now, if this is you and you feel you might be experiencing severe depression or depression in general, reach out to someone that you love or someone that can help you. Your life is valuable and should be something you enjoy and not just cope with. And if you are in the Vancouver area, please reach out to us through phone or email. We'd be happy to help get you set up with someone who can. And until the next video, I will see you later.